Dr. Matt Pyatt is a graduate of Queen's University, receiving an honors degree in life science with first-class standings. Dr. Matt is also a graduate of the Canadian College of Naturopathic Medicine with further training in intravenous vitamin and chelation therapy, complementary cancer care, and injection therapy, including neural and prolotherapy. He has a keen interest in athletic optimization, injury management, and prevention, and the treatment of chronic pain. Dr. Matt's treatment focus is to address and balance the terrain of the body and its hormone levels. So there's a nice round of applause for Dr. Matt Pyatt. Oh, you never know, you might not want applause afterwards.
So we're going to talk a bit about integrative approaches today, and I want to make a little distinction before we get started, because a lot of people, they hear about alternative medicine and they come to me and they say they want an alternative in their cancer therapy or cancer treatment, whether it be alternative to surgery, radiation, chemotherapy, hormone therapies. Not all cancers are alike, and they don't all behave the same way, and we don't typically look at having people come in and say, oh yeah, we can deal with this, you don't have to do surgery, radiation. What we're doing is an integrative approach. We're trying to support your body going through either active surveillance, chemo, radiation, hormone therapy, surgeries, things like that. So a lot of the Western medical community, they use the word complementary alternative medicine, but I just wanted to make that distinction. We're not trying to replace your oncologist or your urologist. A couple of things that I didn't know how specific or vague to make tonight, so we'll go over some basics and hopefully get the brains going. And if you guys have questions, just pop your hands up. I like to make it a little interactive. I don't have you wait till the end, so don't be afraid to jump out if you've got questions and things like that, and get the discussion going. I don't like to kind of stand up here and feel like I'm giving a lecture. I'd rather just be sitting with you guys, hanging out, chatting and stuff, and hopefully give you some more information. So we're going to talk about diet. That's a big one. A lot of patients come into us and ask, what did I do wrong, or is there something? They become afraid of eating. They figure if they ate something that gave them cancer, and it's typically not the case, but we'll talk about some things dietary-wise that will influence potentially outcomes and things like that. Hormonal influences, we'll talk about different hormones other than testosterone. Hopefully some of you guys have heard some more of the other hormonal influences involved in prostate cancer. Improving conventional treatment. We'll talk about a few things that, if you're going through surgery, radiation, androgen deprivation therapy, what can you do? And then getting to the end of it, things you can't do. There's some things that might be surprising, and hopefully give you a little more information. So we'll talk a little bit about some of the advanced modalities that we use at the clinic. I may not go into too much detail there or depth. Something that if you're interested in, I can chat about it more as we go along. So a few things that we want to look at in terms of diet. Sugar. Making an example of all the nice awesome snacks we have. We'll kind of see how that influences things. Is everyone here kind of either on board or familiar with that whole sugar feeds cancer kind of thing? One person's heard of it? Awesome. Okay. So it's a bit of a, no, it's not a bit, it's quite a large extrapolation from research or studies that are done in dishes. So if you've got a dish, you grow some cancer, regardless of what it is, throw some sugar on it, it'll keep going. It's just the tip of the iceberg in animals and human beings, and I'll kind of get into why, what the larger problem of sugar or high glycemic index meals are. We'll talk about vitamin D. You guys have all heard of vitamin D probably, hopefully, and hopefully everyone's taking it. If you live basically north of San Francisco, you're deficient in vitamin D. I don't care if you sit outside during the nice winters we have this year and you're naked, you still don't get enough ultraviolet light, other than frostbite too, to make enough vitamin D. So from about, when does it get dark? October till like now, you should all be supplementing our diets with vitamin D. There's a specific form, we'll talk about that. Is everyone familiar with the brassica family, what those are in terms of vegetables? Those are everything everyone loves, Brussels sprouts, broccoli, cabbage, things like that. We're going to talk about soy. That one tends to be a touchy subject for a lot of people. So we're going to talk about that one. And we'll talk about shrooms, as I call them, because they're great. So the whole sugar feeds cancer thing. You know, we talked about, yes, sugar is a primary source of fuel for cancers. They tend to burn sugar without oxygen and produce lactic acid. They also feed off of a couple other amino acids. One's called glutamine and the other is called glycine. Glutamine you guys may be familiar with. It's one of the highest containing amino acids in our muscles. So for friends or family, if you've seen patients going through treatment and they start losing a lot of lean muscle mass, it's I don't know if you call it a condition, it's more of a concern called cachexia, or that's how I pronounce it. It's the tumor basically producing a lot of inflammatory markers, and it starts to eat away your lean muscle because it's not getting enough glutamine to eat off of it. So sugar is just the tip of the iceberg kind of thing. The bigger problem comes with insulin, and everyone's heard of insulin, hopefully. It's released from the pancreas when you eat a high glycemic or high sugar meal. And the bigger problem with this is it releases a hormone called insulin growth factor 1. So has anyone heard of this stuff before? 2 people? Awesome. Lance Armstrong does great on this stuff. This stuff is 4 times stronger than testosterone, to give you an example of how strong that is. And we all are probably familiar with how, you know, there's this major thought of prostate cancer as a testosterone-dependent condition. So testosterone looks kind of wimpy compared to this stuff. Insulin growth factor 1, highly, highly, highly anabolic. So that's where the bigger picture comes from, is yes, sugar can fuel it, but insulin growth factor 1 is like throwing, I don't know, nuclear waste on a forest fire. Like, it just takes off like crazy. So, you know, we want to be watching what we eat in terms of glycemic index, not just sugar itself. So a great example of this, someone will say, okay, what about, oh, here's a great test for, I give this for my patients. I get a little, Gary, you can't answer because you might know the answer to this. So, has everyone heard of the glycemic index? You're familiar with what it is? So glycemic index is basically, it's a number between 0 and the highest I've seen is 120 something so far. But basically, the lower the number, the less your insulin spikes after a meal, okay? So to give you an example, one of the highest things I had a patient find come to me with an alternative to a dairy ice cream was a soy-based sherbet or something in the United States. I don't think it's sold in Canada. Its glycemic index number is 122. To put it into perspective, a ripe banana is 82, or it can be if it's really, really like the color of my suit. You know, you make banana bread out of it. Something that's really low glycemic index, something like stevia, I don't know if you guys have heard of this, it's a sweetening agent, it's 15, it's very, very low. Ideally what we like to have is meals that have roughly 50 or lower in terms of the glycemic index. So if I was going to give you guys snacks tonight, and I was going to give you a Snickers bar, a piece of whole wheat toast, and a piece of white toast, does anyone want to guess which one has the lowest glycemic index?
Whole wheat.
Snickers does, believe it or not. Whole wheat has the highest. Now, they're all really high. They're all up in the 70s kind of thing. So none of them are good. And the problem with Snickers, caramel is one of the most carcinogenic things on the planet. So we don't really want to have that either. But it gives you an example. The reason why the Snickers bar is actually lower in the glycemic index than a piece of toast is that there's actually fat and nuts in it. So the glycemic index is like math. You can take a Twinkie and have it with a steak, and the glycemic index will come down in the middle. Now, you don't want to ideally have Twinkie and steaks for dinner, but it gives you an example in terms of how this works. So for people who say, you know, what about fruit? You know, that's got a lot of sugar in it potentially, and they get confused, they get worried. What should I do if I'm having a really ripe banana, like I mentioned? Well, have it with something else that's a lower glycemic index, something like almond butter, peanut butter, if you're not going to swell up and die from it, things like that. Does that make sense, kind of? So that's the thing you want to look at with your meals is, if you want to get some more information on low glycemic index diets, basically it's like a diabetic diet. So you can get on the internet and you can always ask, your physicians and stuff in terms of there's lots of resources out there to look at glycemic index. The other problem with sugar is called the glucose ascorbate antagonistic pathway. And what this does, I don't know if everyone's heard of natural killer cells before, but they're kind of like, we kind of tend to use like an army as an example of the immune system. I tend to use Star Wars just given my age and what I grew up with, but natural killer cells are kind of like policemen. They're like your front line, first line defense in terms of what's going on. They try and find the problem, see what's going on. So the other big thing with sugar is that it suppresses natural killer cells. And these are one of the guys, we need them. You know, they're the guys that go and do the job. So around 2 tablespoons of white sugar will suppress your natural killer cells by 50% for 2 days. Coke's got 14 tablespoons in it, and not the big 2 liters a can. So give you an idea of how potent that immunosuppression can be. Now metformin we'll talk a little about later. Metformin's neat because it's a diabetic drug, but it's also been shown to decrease metastasis and kill cancer stem cells. So I'll leave you hanging on that one. We'll talk about it a bit later. Any questions so far? No? Yep.
One is when you talk to a urologist or an oncologist, they will say that diet has very little impact on cancer. And that you can continue consuming sugar.
Continue smoking too.
Yeah. So I just wonder how they get away with that.
How much time do we have tonight? I love these questions. So in terms of, you know, a lot, and I don't want to be rude. There's a lot of great oncologists. There's a lot of great urologists. There's a lot of great doctors out there. So the pattern we tend to see in terms of Western medicine is that if there isn't a multi-center, double-blind, placebo-controlled study for it, it doesn't hold as much merit as a non-blinded study or empirical evidence or things like that. So, you know, what I typically do when we're looking at diet with patients is that maybe your blood sugar control isn't one of the contributing factors, and different cancers have different pathways and imbalances that they feed off. Breast cancer, prostate cancer, they tend to really be blood sugary, hormonal in nature. So what we do is we'll run a panel of tests that are standard tests that your Western medical doctor will run, but we'll use these tests in a manner to assess where are the imbalances in your system. Hemoglobin A1C, fasting insulin, fasting blood sugar, C-reactive protein, other markers for inflammation, and figure out, you know, because we've had some patients that they don't eat, let's say, the perfect anti-cancer diet or something, right? But their pancreas and their blood sugar control seems to be okay. And we can have other patients that, you know, they dabble in too many high glycemic index vegetables, and their hemoglobin A1C and their markers for blood sugar go through the roof. So that's one of the ways we look at it is diet going to cure cancer? No. Not yet. I will share an interesting tidbit, though. I'll fast forward a bit in terms of, you know, some of the literature that, you know, because a lot of oncologists and neurologists say, oh, give me more literature. And then we give them literature, and then it's not enough. And then we give them more, and it's from the wrong country. And then so it's kind of this never-ending, it's never enough kind of thing. But there was a really neat study that they did where, I don't know if everyone's heard about this with the broccoli and early prostate cancers. So what they did is they had gentlemen who were moderate Gleason score, biopsy-proven prostate cancer, just below that gray zone of whether you want to go active surveillance, watch and wait, or jump on top of it and do something. And so what they did is they divided these group of men into 2 groups. The control group just did watch and wait or active surveillance. The other group got 1 cup of broccoli a day, every day. And they measured PSAs 3, 6, 9, 12 months, and then repeated the biopsy at 12 months. And does anyone want to guess what happened to the PSAs for the experimental group with the broccoli? Down? Down? No, stayed exactly the same. Oh, broccoli's diet's no good, right? What they did with the biopsies, though, is they looked at the genetic expression of the samples pre and post dietary intervention, and what they found was that there was a significant decrease in oncogene expression. So the oncogenes are basically cancer genes, and these are things that tend to act like dominoes. You get a couple that are expressed, and you get a couple more, so it leads from something that's going to start growing, then it starts to encroach on its neighbors, then it says, you know what, I really don't like the prostate, it's getting too crowded. I'm going to go exploring. So there's a whole bunch of steps and changes, and what they found after the year is there's this very significant decrease in the behavior of the tissue. So even though they didn't see it on PSA, and again, PSA is not, I'm sure everyone's familiar, it's not a perfect test, but you know, not every healthcare system and physician wants to be doing biopsies and genetic markers and all that stuff. So we have more and more of this diet data coming out and stuff. So I don't know if that helps answer your question at all. You know, it's one of those things where we got to look at your biochemistry and see what's going to make the best difference for you.
Right. But I didn't want to put you on the spot.
No, that's okay. I get us put on the spot all the time. I enjoy it. So I can't wait to go to Tom Baker in a couple minutes. It's going to be great.
Like sugar-free, lactose-free, gluten-free.
Yeah.
But I'm just saying that when I consult that or mention that to a urologist or an oncologist, that's what they come back.
They're not cheering, right?
Yeah. The one other item that you mentioned was vitamin D.
Yep.
And I got my vitamin D read, and then it was low. So I did 10,000 milligrams of vitamin D a day.
Was it D3?
D3.
Okay.
And it came right up to 160. Right over, should be, I think, 200 stuff.
220 is kind of the max. We like to see it 140, 160 as an ideal measure. Yeah.
So, and that proved to me that, you know, taking that supplement improved my vitamin D right away. But then they told me vitamin D is not good for you, and that you should reduce it to 1,000, 2 at the most.
Okay.
So I'm perplexed.
Okay. Anything that has therapeutic benefit has potential therapeutic risk involved with it. The biggest problem with vitamin D, empirically, is that you can run into, because it's a fat-soluble vitamin, it's stored in your tissues when you start taking too much of it and your body stops using it. The theoretical problem here is that you run into calcification of your tissues, and typically wherever there's chronic inflammation going. So if you've got a joint that's inflamed and you're taking way too much vitamin D because someone's told you it's an anti-inflammatory compound, you start calcifying the joint, you get bone spurs. Awesome. Bigger problems. You start calcifying, say, breast tissue or prostate tissue, and your image shows that there's something suspicious going on there. And then you may end up with unnecessary biopsies, you know, fear, things like that. So we use vitamin D, and it's important when you're taking larger doses is to have your blood levels monitored, right? So once if we see people that are really low, we'll megadose them. My patients come back from the Mayo Clinic at 25,000 a day, and I almost fell off my chair. So I'm like, oh, 'cause my comfort zone was like 10 grand kind of thing. I'm like, oh, that's really high. It's Mayo, they must know what they're doing. So, you know, we track your blood work. And I've had one patient in the last 8 years where we got them into 300 with their blood level, which was way too high. So we took her off of it for 3 months, and it's come right back down into the hundreds, I think. So the other tricky thing with vitamin D is it can upregulate the production of estrogens in the body if you take way too much of it. So we'll talk about estrogens down the road a little bit as well and why they're problematic, not only testosterone as well.
And shouldn't it be taken in combination with vitamin K?
It can be, it doesn't have to be.
Is that a good way to?
Depends on the form of vitamin K, and it depends if you have clotting problems, and it depends if you're on blood thinners, because vitamin K is involved with blood stickiness. And blood stickiness, clotting is a big problem with prostate cancers. So they tend to be very pro-inflammatory. Blood gets really sticky, really thick, lots of worries about clots and stuff. So You have to watch your vitamin K because you don't want to turn your blood into jello. Typically, if you're going to be taking vitamin D, it's a fat-soluble vitamin. Please take it with fat. Don't take it with a black coffee or a glass of water. You might as well just toss it in the toilet. It'll go right through you. Anyone who's had their gallbladder removed, we tend to find they need more vitamin D given their mass because they have trouble emulsifying their fats and absorbing it properly. So there's a question here. Yep.
Yes, can I ask you to speak a little louder?
Sure. How's that?
Thank you. That's good.
Awesome.
So
Yeah.
Here.
I've had my gallbladder removed and I didn't hear what you said about that.
Okay, so
I couldn't understand it.
okay. The gallbladder is involved in emulsifying your fats, which makes them absorbable from the small intestine. If you've had your gallbladder removed, I found a trend in people where they have a higher need of dosing their vitamin D because they have a decreased absorbability of fat-soluble vitamins. So if we have someone who's needing 5,000 units based on their weight, and then we have another identical twin, and they've had their gallbladder removed, they may need 6,000 or 7,000, just because there's that lack of absorbability there.
My doctor told me to take 3,000.
Have you had your blood levels checked?
For the first time in my life, I did.
Awesome. Were they low?
128.
Perfect. So if we look at if your blood levels are low, we typically look at dosing 50 units per kilogram of mass. So if you weigh 150, 160 pounds, it's roughly 3,000. During the summertime, if you like to get out in the sun and whatnot, you can take that down a bit, 2,000. Yep.
What was it you said that, should you take the vitamin D with?
Fat. It's fat soluble. So McDonald's, burger, gravy,
Thank you.
fish oil, whatever floats your boat. Yeah. If you just have it with water, you're not going to absorb it. So typically that just means take it with food. Right? Most of us have some fat in all of our meals, kind of thing. Any more vitamin D? We're good? Okay. Insulin growth factor 1, bad. Okay. Creates resistance to radiation therapy. That's usually not good because that's typically one of our top therapies in prostate cancer treatment. Inhibits apoptosis. I don't know if anyone knows Latin or have heard of apoptosis. Some people pronounce it apoptosis. I say apop. I don't know what's right. Natural cell death. Every tissue has a natural cell death to it. So there's this constant cells dying, cells growing, cells dying, cells growing. If you inhibit cells from dying, they start misbehaving. You can see where that leads to. It stimulates clonal selection, survival of the fittest, basically. So what that means is basically, if you're doing a therapy, any kind of anti-therapy, so if you're doing an antibiotic for an infection, you're doing an anti-neoplastic for cancer treatment, you're going to kill off all the wimpy cells, and then IGF-1 helps the ones that were left over that weren't killed, grow more. So what happens is, let's just say this is a tumor and we're all cancer cells. That's not a very happy picture, but we'll use better ones down the road. So basically, let's say we use a treatment and kills off 99.99% of us. So there's one of us left, and you guys can all arm wrestle, decide who's left. But you're getting more IGF-1. So what does that mean? You now repopulate that tumor with a whole heck of a bunch of cells that are resistant to stuff and stronger. So we don't like that typically. Most people don't. And again, I mentioned earlier, it's highly anabolic. It causes tissue replication. So if you're an Olympic athlete and you like doping, great. Typically for the rest of us, we want to keep cell replication in check. So we don't want to have a ton of this floating around in our bloodstream. Vitamin D, we talked a whole bunch about this. Now there's 2 vitamin D tests that you can look at getting. One is called the 25-hydroxy, the other is called 1,25-hydroxy. The 25-hydroxy is the one you want to be having run. It correlates to your bone density. I mentioned, there's a specific form you want to do D3, not D2. Okay? D2 will actually suppress the form of D3. D3 is the active form in our bodies. So I've come across it once where someone was bringing in a vitamin D supplement from Community Natural Foods. I don't know which one it was, but it had D2 in it. And we just took it and threw it in the garbage and told her to go get a better one. Vitamin D is an anti-inflammatory. It decreases insulin. It decreases insulin growth factor 1. It's needed for white blood cell activity. It's needed for bone building. It's needed for preventing cancer, reducing risk of recurrences, preventing primaries. Like I said, if you live north of San Francisco, you are deficient in it. So, good stuff. Veggies. So, we talked about brassicas a bit. So the brassica family is all those ones everyone hates as kids, right? You know, the broccoli, the Brussels sprouts, and all the stuff you only have at Christmas and Thanksgiving. That's about it. These have a lot of great compounds in it, and one of the biggest, or two of the biggest ones are I3C and sulforaphane. Now, sulforaphane is part of that component that I told you about where they did the test or the trial with the gentleman where they saw the changes genetically on their biopsy reports. And that's found in sulforaphane. You can get it in supplement form, but if you like broccoli, have a cup of it a day. Saves you from taking pills. Question?
Cook, is it a raw, cook, or steam?
If you like being gassy, raw is better. But cooking it typically won't destroy the sulforaphane molecule that much. Right? If people have had, if they're undergoing chemotherapy, surgery, radiation, their digestive tracts are not too happy, then we tend to have people boil it and then blend it. Make it easier to digest, right? Because if they throw raw veggies in there, yeah, it sounds gross, like broccoli smoothie, but throwing in raw broccoli is just going to wreak havoc on the digestive tract that's going through chemo or radiation. So I3C is another one. This one's really important for improving hormone metabolism. We'll come back to this one, but it does have direct anti-cancer action as well. So has anyone here been tested for BRCA1 or 2 mutations? Or has anyone ever heard of those before? No. So the BRCA1 and 2 genes, these are DNA repair genes. They typically in Canada are only tested in women with breast cancer. Men also have these genes as well, and they can be mutated in men. If they're mutated in men, your risk for colorectal, pancreatic, prostate cancer, and melanoma rise significantly. I3C helps those genes to turn on properly and work better. So it's a very important one for anyone who's been tested for BRCA1 or 2 positive. It tends to be higher in people who are of Jewish background. There's a very high rate of that mutation in that population of people. So it's not typically tested in Canada in anyone other than breast cancer patients. But if you have a very strong family history like me, where 90% of your families had cancer, there may be, especially if you see a lot of breast and ovarian cancer in women, there's probably a decent likelihood that there's a mutation in that gene that's not working properly. If you're paid to get the test done, you can do it. I think it's a couple grand in Canada. It takes about a year to get back. If you go to the States, you can get it in 2 weeks or less. So. Sex hormones are excreted primarily through the bowels. So testosterone, estrogen, progesterone, everyone's probably heard of those guys. They're all stimulating hormones in terms of replication. You eliminate them primarily through pooping. And everyone thinks it's a funny topic and uncomfortable. We talk about poo a lot at work. If you're not going to the bathroom 3 times a day, your bowels aren't working properly. Okay? Does anyone here have pets? Dogs? Food goes in, dog goes out, food comes out, right? And everyone's like, oh yeah, I never thought of that, you know? How often do you have a bowel movement? Once a week. Why? Do you only eat once a week? Now, there's other considerations to take into account, pain medications, therapies, and things like that. Keeping your bowels moving is a very important way to eliminating extra or excessive hormone imbalance in the system. So when you're doing androgen deprivation therapy and you get buildup of hormones in the bloodstream, you want to make sure your liver's processing them properly and eliminating them. I don't know why I put this in, just for headaches tonight. Phytoestrogens, everyone's heard that term before? Potentially? Phytoestrogens, Bain's plant estrogen. They're about 1,000 times weaker than the estrogens our body makes. They're actually very protective and beneficial for us. They finally figured out soy and flax are fine for hormone-related cancers, be it breast or prostate, in your diet as a food. Okay? A lot of people, like I mentioned earlier, I get people that come in, they're scared of eating, and they go for dinner and like, oh my God, my salmon's got soy sauce on it, and they freak out and think, it's fine. It's not gonna stimulate cancer growth. What these plant estrogens do is they actually increase blood values of something called, it's a mouthful, sex hormone binding globulin. It's basically a sponge in your bloodstream that mops up free testosterone, free estrogen, free progesterone, so it's not available for your tissues to use it to replicate properly. So they're very good things to have in our diet. They also block a specific estrogen receptor called the alpha form. There's 2 forms of it. Alpha's bad, and if you block that, you get less progression of hormone-related cancers, prostate included. Okay?
How much flax should you be taking?
Couple tablespoons. Perfect. Yeah, a couple tablespoons ground up, way you go. Oatmeal, applesauce, not yogurt, because we haven't talked about dairy. Does anyone want to talk about dairy? I didn't put it in here, but
Yeah.
we do? Darn, okay. Okay, has anyone heard of the protein in dairy called casein? Casein? Oh no, that's how I say it. There's another one called whey. People have heard of whey protein powders. There's another protein called casein. It's found a lot in dairy, mostly in cheeses. Casein stimulates an enzyme in our cells when it's broken down that lets them go walkabout. Okay, cool. I got some cancer. Well, not cool, but you know what? If it's localized and it's hanging out here, I don't know, bug it. It doesn't bug me. I get along. No big deal. The biggest problem with cancers is when they start exploring, right? So dairy is one of those things where we don't want to have a lot of casein in the system. We're basically the only mammal that breastfeeds off a different mammal when we're done being breastfed. Haven't found anything that does it naturally in the planet other than us. So dairy bad. Any questions? Hopefully not. Darn. Yeah?
Is there a minimal amount of dairy, that's acceptable? Let's say you have a cappuccino.
Yeah, it's not going to kill you. And that's the thing you got to look at dietary wise. I tend to have patients try and follow a 90%, 10% rule. You can figure out which one's the good, which one's the cheating, right? So you have the odd cappuccino, the odd slice of cheese here and there. It's probably not going to influence it a huge amount. But if you're someone who eats dairy at breakfast, dairy at lunch, dairy at dinner, a couple glasses of warm milk before bed, you're plowing through this stuff like crazy, probably not a good situation to do if there's a risk of metastatic process going on in the body. But don't be afraid, if you have a latte, cappuccino once a week, twice a week, don't be scared of it.
So how do you get your calcium if you don't have?
Vitamin D. Vitamin D upregulates your calcium absorption from your digestive tract.
So there has to be calcium there for it to digest.
Yep. Fruits, vegetables, there's lots of other sources. So if you guys want, and bring a piece of paper. I'm sure there's a piece of paper somewhere. If you want, give me your email addresses. I can email you like sources, non-dairy sources of calcium and things like that for you guys if you're interested. So there's lots of other ways. And that's a good question. A lot of people ask, okay, if you're taking my dairy away, what about calcium? Because it's kind of drilled into us in terms of, we need to have milk for calcium, but there's a lot of other great sources out there.
So do you not recommend taking calcium tablets?
Supplements? We'll get to that actually, yeah. Okay. I think it's coming up here.
Well, you are saying that excess of dairy, milk, yogurt, cheese induces cancer?
It can promote metastasis. It doesn't give you cancer, but it stimulates enzymes that cells use to move around. Okay? You know what? I'll talk about shrooms. Mushrooms. So one of the key enzyme pathways, there's not just the dairy, that causes or can stimulate enzyme processes that cause metastasis. There's another one called UPA. This one is directly blocked by reishi mushroom. I don't know if you guys have heard of reishi mushroom or any of the mushrooms before. Reishi's got a lot of great data around its ability to prevent metastasis and stimulate white blood cell function. It's used almost across the board in Asia during most cancer therapies, chemotherapy, radiation. It's very, 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 very helpful and typically very easy to take. Even plain old button mushrooms. So you don't, people say, reishi and shiitake and all these, crazy fancy mushrooms are $500 a kilogram or something at a grocery store. Your dinner ends up costing you 10 grand because you got all these fancy mushrooms and stuff on it. You can just do plain old button white mushrooms as well. They're very beneficial in terms of improving hormone metabolism as well. So cup a day of that, cup a day of broccoli, good to go kind of thing. Very helpful in terms of dietary
Just carry
approach.
them in the supermarket.
Yep. Yeah, the little white ones, they come in the bulk and you get your paper bag and you just pour them in kind of thing. They're great. Yep.
You know what dosage of red reishi?
Red? Most of the mushroom extracts, we typically look at 3,000 milligrams a day. Whether it's reishi, shiitake, turkey tail, all those guys. It's typically what they're using in Asia alongside radiation, chemo and stuff. Yep.
And the button mushrooms be cooked?
Yes, definitely. Throw them in olive oil, throw some garlic in there. Great. Garlic I didn't put on here. Does everyone like garlic? Great. Great little trial they did with garlic extract with women. No, this doesn't apply directly to the gents, but for women going through chemotherapy and breast cancer, they supplemented a tablet of garlic a day, and it doubled their response and median survival during chemotherapy. Can't go wrong there. Easy to take, doesn't interact with anything. So mushrooms are another great one you can include in your diets as well. Any other diet questions so far? Doing good? Okay. So, estrogen, most people have heard of probably, I would think. Okay. Prolactin, has anyone heard of this guy before? If you're a woman, you're probably familiar with it. If you're a gent, you may not be. Prolactin is a hormone that causes lactation when you're breastfeeding. Men and women produce it naturally in our bodies. Women just produce it more when they're breastfeeding and pregnant. But we see higher levels of estrogen and prolactin in the body when there's a progression to an androgen-independent state, or basically when the anti-hormone therapies stop working. So one of the things we always look at with patients is tracking not only testosterone levels, but also estrogen, progesterone, and prolactin as well. Because if these two guys are out of whack, we want to get them under control as well, because they can be very stimulating to tissue as well. Melatonin, hopefully some of you guys have heard of this before. It's the hormone that we make naturally in our brains for sleeping. Taking it can stabilize and resensitize hormone-dependent cancers to their anti-hormone therapy. So if you're a gentleman, you're going through androgen deprivation and it looks like it's starting to not respond as well, or for women who are going through the anti-hormone therapy for hormone-related breast cancers, melatonin's got a ton of literature around it in terms of helping to stabilize disease. It may not cause regression, but it can really slow it down or stop it in its tracks. So very helpful. You have a question?
It's also the only medication you can take for sleeping disorder that does not become addictive.
Exactly. Yep. So that's a really nice one.
Trying to take less than 10 milligrams.
Yep. It's a nice one because it's not involved in what are called negative feedback loops in the brain. So really, really nice there. So you can take it one night and not take it the next night and take it again and start and stop. No big problem there. Question in the back?
Yeah, is that like 20 milligrams? Or?
The literature in terms of really resensitizing and blocking hormonal influences with the hormone-related cancers is at 20 milligrams at bedtime. Not everyone can get to that. The major side effect of taking too much melatonin is sleeping in. Okay? You can mix it with your sleeping medication. Side effect, sleeping in longer. Okay? There's a very, very, very small amount of people that if they take melatonin, they get nightmares. And really wicked ones. My wife's one of those people. I woke up to a fist in the face one night. It was not fun, and she hasn't touched it ever since. It's very, very rare, but it can happen. So we always tell people, if you're going to do melatonin, talk to someone about it, because it's a hormone. It's a powerful substance, but very, very helpful.
I also heard it has natural cure.
There's a ton of stuff I could talk all night just on melatonin. There's immune stimulation. It decreases stress hormones. It prevents lean muscle wasting. Can reverse cachexia, which is that, you know, loss of more than 20% of your mass within a couple months. It's that slippery slope during radiation or chemo that people run into. It's an awesome hormone. Like, it's one of those things where people come to me and say, you know, if I was only going to do one thing and it had to be really inexpensive, what would it be? Melatonin.
And it's well priced.
Yeah, and it's an inexpensive supplement too. Yeah?
Well, melatonin, you can eat in cherries got most of it.
Where? Cherries?
Cherries, yeah.
Yep. I don't know what milligram dose cherries would have per cup. I'd have to go calculate it out. Does anyone know or heard of it? Yeah. I can look it up and let you know. One of the things that there's another compound in green tea that interferes with chemotherapy, and a lot of people say, you know, oh, don't take green tea during chemotherapy because of this compound. So we calculated out, and there's another one in blueberries. So we calculated out the amount of blueberries you had to take to interfere with chemotherapy, and it was over 12 cups a day. Probably interferes with chemo at that point because you can't get out of the bathroom because you're going to the bathroom so much. So yeah, when you're taking most things in food, you're not going to really, in reasonable doses, you're not going to run into any problems. I haven't had anyone try taking a bunch of cherries at bedtime to see if that helps. But
You don't have to. All you have to get melatonin.
yeah.
And within an hour and a half, you can fall asleep just like that.
Awesome. We can all try it. Yes?
Am I reading that last line right? Like if you're on hormonal therapy, do you have a greater tendency towards inflammation?
Yes. Yeah, we're going to get into inflammation and you know, the whole hormone thing. So chronic inflammation is something that is a huge problem with any cancer of any organ. Now, in the States, we can actually measure this hormone called interleukin-6. In Canada, believe it or not, there's not a single lab in the whole country that can run it. I have no idea why. Interleukin-6 is a pro-inflammatory hormone, and it's associated quite a bit with androgen independence. And what happens when they become resistant to androgen deprivation therapy, the cells themselves say, you know what, you're getting taken away my testosterone from me, and I still like it. So you know what? Forget you. I'm going to make it myself and just spill it out into the environment around me and then suck it up again, and it's going to help me grow more. So it's called autocrine, or self-stimulation, basically. Chronic inflammation is associated quite a bit with this. There are a number of things that can block it, you know, green tea, melatonin, trameal, turmeric or curcumin, a whole bunch of things. Even aspirin, 81 milligrams a day, super beneficial. I'm not telling anyone here to take it. Ask your doctor first before you start that, okay? You have to be cautious if anyone's got risks of bleeding, blood thinners and things like that. But aspirin, 75 milligrams a day. I just came back from a big integrative cancer conference. 75 milligrams a day can decrease your chance of all-risk mortality by up to 40%. That's huge. And it's one of the safest, easiest drugs to take as long as you're not on any other blood thinners or risk of strokes or clots, or not strokes, aneurysms, clots, things like that. So chronic inflammation is also associated with a lot of the symptoms we see alongside therapy. So pain, fatigue, depression, low white blood cell counts, lean muscle wasting. These all have a huge chronic inflammatory component to them. So instead of, I do have some patients, they have places down in Arizona, so when they go down during the winter, they'll go and see a colleague and they'll get these different immune hormones measured. Up here, like I mentioned, we can't do it. We measure the byproduct of these hormones and the immune system's making to get an idea of what is going on chronic inflammation-wise in your body. So like we were talking earlier about the influence of diet on your biochemistry, we'll also measure blood work and blood levels to see, are you chronically inflamed? Do you produce an environment for cancers to grow blood vessels? All these sorts of things, so we can really narrow down our treatment protocols. Because I've had people come in to me, I kid you not, we covered in a table the exact size of one of these big tables in supplement pills. She came out of retirement because she saw some doc in New York He said, take all this, it'll help. And I was like, that's ridiculous. Like, yes, if you're going through integrative cancer therapies, there are at times more supplements or things you can take, possibly. But that was just ridiculous. So I said, okay, this is dumb. I'm running a whole slew of blood work on you, and we narrowed things down, and we took like a couple months worth of pills for her and put them into categories: anti-inflammatories, immune stimulants, anti-metastatics, blood vessel dilators, so on and so forth. Basically had like 2 or 3 years of stuff. So she said, great, I can retire again, I can go down and see my family in Brazil and not, waste all this money on supplements, and she's been doing really well. So, question?
Yeah, is there any other negative effects on the aspirin other than the blood thinning capabilities?
There is a small risk of GI or stomach gastrointestinal irritation for the first 2 years if people take it daily. That's why they always recommend taking it with some food. After the 2 or 3 year point, there seems to be some shift, and they don't know why or how or what happens, but there's a shift in the digestive tract, and that risk of digestive tract inflammation, ulcers and things like that, it just disappears for some reason, and they don't know why. So always take it with food if you guys are taking your aspirin, and if you've been on it for a couple of years, don't even worry about it. So, any other questions? Chronic inflammation? Yep.
15 years ago, when my cancer started, and I was on a hunt for cure for it, so I went on internet, got Boston University, the medical center, and they had posted Habanina peppers.
Okay.
And I said to myself, well, I'm going to try it, but if nothing else works. So when I went to another friend of mine, he was on it, and he said, you take it with your Habanina peppers and mixed it with yogurt.
Okay.
With yogurt.
Yeah.
So what do you call it? I got in August 10 years ago, about maybe 6-7 pounds of Habanina peppers, dry them, and then after I dry them, I crush them, and have a tablespoon in the morning.
Okay.
Guess what? The cancer is gone.
Yeah, that's fantastic. So did everyone hear that?
Yeah.
A little bit? So one of the things with peppers and stuff, so there's a compound in them called caspacin, and it's got some significant anti-cancer properties to it, but also a significant amount of blood vessel dilation properties. So that's that whole, you eat something spicy and you kind of flush and get all hot. That's that compound. Now one of the things that we always try and do with patients, and it makes no sense when we first tell them, is that we want to increase blood flow through the tumors. And they look at me like I got horns coming out of my head. Like, why the heck would you want to feed it more stuff? I want it to go away, right? One of the biggest problems is that cancers, when they make blood vessels, they become very leaky and tortuous, and it's as if grade 8s have done the expansion on Glenmore and not the people who were supposed to. So you can imagine, they could probably get the job done, but the road's going to be pretty much how it is now. So what happens is that you get this great blood flow through the bloodstream and things like that, and then the blood flow comes into the tumors and it just slows down like crazy and it stops. It's like Deerfoot at 5 o'clock, right? Just like, it slows like crazy. What happens is it becomes stagnant, the oxygen levels drop in the tumor tissue, and it becomes what's called hypoxic, or very low in oxygen. That stimulates something we're going to talk about a little later called mTOR and VEGF, and these are two hormones that basically, in English, mean blood vessel growing hormones. So when a tumor becomes 1 millimeter cubed, it has two choices: put a pipeline in or go away. And typically, unfortunately, they usually pick number 1 and put a pipeline in. So if we can limit the amount of hypoxia or low oxygen within the tumor tissue, you get a much better response to all treatments, I think. So this is why in a lot of integrative cancer centers in the States, you get chemotherapy while working out. Or after radiation, you go and work out. Get the oxygenation, get the blood tissues, get everything flowing through it. There's even trials where they're using Viagra alongside chemotherapy. Might make chemo maybe more pleasant to deal with, I don't know. We use other substances that are a lot safer, have less side benefits or side effects, depending on what way you look at it, to help dilate blood vessels and get stuff to where it needs to go. So that's probably where the benefit you had with taking, you know, tons of high caspase containing foods, is that it partially involved in oxygenating the tissues and whatnot. Yes?
What type of peppers does this gentleman use?
Habanero?
Habanero.
Yeah.
How do you spell it?
No idea. I think it's J, isn't it? Is it H?
Yeah, it's a-
Habanero.
Probably Google H-A-B-I-N-A-R-R. A-N. Do you have another question, Stella? Sir? No. Okay.
I was just going to say I take habanero.
Okay, so we're going to move a little more into the inflammation thing here. So NF-kappa B, you guys have probably never heard of it unless you really do lots of doctor Googling. This is basically one of the master switches of inflammation. It's one that is constitutively or basically overexpressed all the time in all cancers. And they're trying to get a drug that will inhibit this enzyme. We already have one in our diets. It's called turmeric. Works fantastic. So chronic inflammatory markers I mentioned earlier, they're associated with clotting and things like that. So one of the things, you know, the biggest problems we can have going through treatments is running into these bumps along the road. You know, throw a clot, you got to stop therapy, you got to get on blood thinners, you feel horrible during them, you can't sleep well, you can't go over, we basically can't drive in Calgary because the roads are so bumpy and you hit a bump and, you know, your gum starts bleeding or something. So this is where we really want to watch chronic inflammation in the system. The other thing is that chronic inflammatory responses, the proteins that are made in the bloodstream, they help cancers move around. So it would be like if I had roller skates on and I wanted to go to the back of the room, fibrin and all these other sticky proteins that chronic inflammatory responses make, they act like a rope and they let cells move around and stuff like that. So chronic inflammation is a biggie, and this is where we do blood work with patients and say, okay, are you really inflamed? And if you are, let's put that fire out because it's doing nothing good for us whatsoever. So, question? Yeah, curcumin is just one of the 300 compounds in turmeric that's helpful. So you can do curcumin. You have to be careful with curcumin and chemotherapy. It messes with pretty much all of them. Curcumin is very helpful at helping improve radiation therapy though. It's a very radiosensitizing botanical. So looking at a little bit in terms of, you know, improving our conventional therapies, you know, what can we do to get this stuff to help work better, right? Especially if we're dealing with recurrences, you know, you've had a multiple number of therapies before, or, you know, we want to make sure, okay, this is the last time I want to do this therapy or have to do it. How are we going to make it work better? So with radiation therapy, radiation, like I mentioned earlier, it does not work well with high insulin growth factor levels. It is suppressed from working in low oxygen and high acid environments. So this is where I mentioned exercise, blood vessel dilation, improving blood flow, oxygenation, because radiation therapy is an oxidative therapy. So what that means is it needs oxygen to cause cell damage, okay? So if you're in a low oxygen environment, you can irradiate the heck out of something, it's not going to work as well as if you get a lot of blood flow and oxygen into the area. So this is where working out, magnesium, B3, capsaicin, all these blood vessel dilators. If you got Viagra, ask your radiation oncologist first before you take it when you get radiation. So we use stuff that we're a little more familiar with. And chronic inflammation inhibits radiation therapy as well. So there's some papers and literature showing where doing things like aspirin or Celebrex, these really potent anti-inflammatory drugs, can be very helpful in terms of improving the outcome of radiation therapy. And the other one we talked about earlier is reishi mushroom. You want to avoid vitamin E, smoking, synthetic forms of beta-carotene. Carrots will not inhibit radiation. Synthetic beta-carotene will. So multivitamins as an example. CoQ10, some of you may have heard of this vitamin before. A lot of people take it if they're on a cholesterol lowering medication. If you're going through radiation therapy, you cannot take it. And green tea, you cannot take as well. So, a couple things, yes?
That's interesting. Your comment about beta carotene. I was diagnosed with an eye problem about 7 or 8 years ago. And recommend I take Vitalux. There are two forms that come, one with and one without beta carotene. So if you're a former smoker, you should avoid the one with beta carotene.
Yeah.
I stopped smoking 14 years ago, but I continued to take a multivitamin, which was loaded with beta carotene for those years. And I finally found a multivitamin about 2 years ago, a London drug that doesn't have beta carotene. But I developed lung cancer, and I stopped taking beta carotene. And now the inflammation in my lung is reduced by 2/3.
Awesome. Yeah. Is everyone familiar with the problem with beta carotene in smoking? Okay, we're going to digress here a bit, but so cigarettes and beta carotene as a vitamin, beta carotene will accelerate the carcinogenicity or cancer-causing properties of cigarettes. We have no idea why. So we tell people if you're a smoker and you take a multivitamin or beta carotene, well, A, stop smoking, but you know, that one's usually harder to do, so at least stop your multivitamin or find one that doesn't have beta carotene in it. The other things you don't want to take are copper and iron. Copper is a big component of making blood vessels. Iron is something that stimulates cancer growth as well as chronic infection. So those are your two biggies you have to watch for as well. So for anyone who has friends or family who are smokers and they're taking multivitamins, go home and check them. Make sure they're not taking any beta carotene. Okay? Yep.
I have a question about the Q10 and the green tea.
Yep.
Why is it you should not take it?
They're too potent an antioxidant. They'll inhibit the radiation therapy from working properly. So they're good to take once the therapy is done to help improve tissue repair, but they work too well that they'll actually inhibit the therapy, the radiation from working. Yeah. Has everyone heard of sedate and bake? That's what my patients call it. Hyperthermia. Hyper, not hypo. So this is using very, 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 very high temperatures or very high heat. It's been used in Europe for over a quarter century. Health Canada just approved hyperthermia this past summer as a cancer therapy, which is awesome. It's very, very helpful at improving especially radiation therapy. It's very helpful for chemo as well, but for radiation therapy, it works extremely well. Some of the data you can look at, it either can increase your response rate to radiation therapy anywhere from double to, seen some other things where they're looking at increasing overall survival from 60-some-odd% to 80+%. Like adding 20% to an overall survival rate is phenomenal. So there's 2 places in Canada that offer this right now. One's in Langley and the other is in Richmond Hill. Richmond Hill in Toronto.
Hyperthermia, how many times can you use it?
I'm not an expert in it. I'm hoping to get one of these machines in Calgary when I win the lottery. They're not cheap. Keep going. Double that. That aside, so the treatments aren't cheap when you get them done.
It's not like a sauna.
Don't go in saunas. It actually stimulates growth. You have to hit at least 41 or 42 degrees Celsius. You don't hit that, you're just improving tissue growth. So they use regional, local, they use a special device and it looks like a giant, kind of looks like this almost. Whoop, looks like a giant ultrasound head. You stick it over top of the tumor area and you feel nothing. But it cooks that tissue up to 47 degrees Celsius for about an hour. It works extremely, extremely, extremely well. If you guys want more information on it, you can email me or call me or something. Really, 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 really cool. So especially you know, if you're going through radiation therapy and you want to help that work better, phenomenal stuff. Yes?
You referred to sauna, what about steam bath?
Again, you don't want to spend a ton of time in them. If you're going through radiation, it's going to increase circulation, things like that. Awesome. Let's do it then. But I don't have enough data personally to say doing a steam room every day is going to be harmful or beneficial. So I can't answer your question with a definite answer there, I'm sorry. Yes?
Do you have an opinion on far infrared sauna?
I don't, because I haven't researched them enough. Yeah, I'm sorry. I'm not someone if I'll make up an answer, like some docs, oh, naturopath's crazy.
I'm using one, so I can get the answers.
Yeah, I've had people say, you know, they've used them during treatment and radiation and stuff, and I say, well, take your thermometer and see if you can get up to 41, 42 degrees, and I haven't had anyone yet been able to. So I don't know, I can't give you an answer. So, but this stuff, it's done in a medical setting. Okay, you can't just go home and like, you know, sit on your microwave and turn it on for an hour and away to go kind of thing. Probably make things worse. So, but this stuff's really cool. I'm really excited to know if we can get in Calgary here. Hormone blockade. Everyone's probably heard of this, and it's one of those therapies they'll go to in terms of suppressing growth factors, basically. We always run them: testosterone, LH, FSH, estrogen ratios, prolactin. We measure them with all our patients every so often to make sure things are working properly. You can improve the hormone blockade or the androgen deprivation therapies with low glycemic index diets, right? And that's where we want to monitor blood work to make sure that we're really keeping blood sugar in check. Androgen deprivation therapy can promote metastasis. It's one of those things where there's a bunch of chemotherapies as well. Minor side effect increases metastasis. So it's like, you know, thanks, but no thanks. So there's a substance called MCP. I don't know if anyone's ever heard of it or taking it. It's modified citrus pectin. It's a very, very potent anti-metastatic. It's like putting glue on cancer cells, basically, so they can't hold hands and move around. It's very, very awful. One of the things to avoid, and I see this in a lot of people, you know, if they're dealing with liver detox or liver metastasis, is they take milk thistle, which is known to be a very helpful botanical for the liver. Long-term use of this, so we're talking 3+ months, can increase prolactin. And if you recall earlier, we talked about prolactin helping prostate cancer shift to an androgen-independent state. Not a good idea. So dandelion is another one you can do that doesn't seem to do that. Increase prolactin, and it's a nice one for liver support as well. Side effects. So, is anyone here doing androgen deprivation therapy and loving the menopausal symptoms? So, it does it because it basically puts you in the hormonal state, or it should, that women go through with menopause. So you're not going to get probably any sympathy from your spouses or loved ones or anything who've gone through menopause. They're probably laughing at you, you know, while you're sitting there on top of the sheets sweating away. Acupuncture can be very helpful. We talked earlier about the brassica family vegetables in terms of improving liver metabolism. Get the bowels moving, make sure you're going to the bathroom. Food goes in, food goes out, right? And melatonin we talked about can be very helpful in terms of improving the response rate to the androgen deprivation therapies as well. Bones. You know, we talked a bit about vitamin D and calcium and things like that. Bones are one of the places that a lot of cancers like to go. You want to look at improving bone density with vitamin D3, which we talked about, K2, we talked about a little bit. Just have to be careful with your clotting factors. MCHA, probably no one's heard of this, microcrystalline hydroxyapatite. In English, bone extract. It's the best form of calcium supplement you can get. It will help strengthen bones and improve your bone density. If there's metastasis there already, it'll help slow it down. If there isn't metastasis there, it'll strengthen your bone density. You see it work very, very well, almost 100% of the time, improving bone density. Very helpful stuff.
What did you call it?
Microcrystalline hydroxyapatite.
English word. What is it?
Pardon?
Bone extract?
Yeah, it's like a bone extract, basically. Yeah, so the other thing you gotta watch for is your acid-base balance. We haven't talked too much about acid-base balance, but if your body's very, 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 very acidic, it will leach minerals out of your bones. So, yes?
So, the last point there was to watch your acid-base balance.
There we go. Yeah.
How do you do that?
Everyone remember litmus paper from chemistry class or science class or hot tubs or fish tanks?
Put it on your tongue?
Yeah, it's pH paper basically. Every body compartment has a different pH in general, okay? You can use your saliva, your urine, or your blood. We usually don't have people do their blood pH at home because they bleed everywhere all the time. So. But it's easy enough to lick pH paper, pee on it. Lick it first and then turn it over, pee on it. You laugh, I've had someone ask me it at work, okay? So you never know. So you gotta lay it all out. So typically, I didn't throw the graph in here. Your pH should shift throughout the day. Acid, alkaline, acid, alkaline. Anything that's flatline and rigid is bad. The best example of that's heart rate, right? Flatline is not good. So if your pH is stable all the time at 5, not good. If it's stable at 7 all the time, not too bad. But we want to have variation in the pH because we want to be dumping acid, detoxifying, things like that. So we usually have an indirect measure. People do it 3-4 times a day for a week at home using their urine. They graph it and they bring it to me. And we assess if their pH is really out of whack or not. So it's not a perfect science. Ideally, if you took a human and put it in and juiced it, if you put some pH paper in there, it should be like 7.4 kind of thing. But if you put litmus paper in the stomach, it should be a pH of 2, which is super acidic. So every body compartment has a different pH. So when we're using the urine, we're using an indirect measure, watching the kidneys, making sure they're excreting hydrogen ions, which are acids, and then building them up and excreting them again. Does that answer your question? Yeah. Yep.
Where does this bone extract come from?
I haven't actually checked. It's not humans. Probably bovine.
Where do you purchase it?
Most health food stores, if you go to the bone section or the calcium section, just read the labels. It should say MCHA on it, or microcrystalline hydroxyapatite. Works really, really well. The next best one down from that is calcium citrate, highly absorbed as well. This stuff just a little bit better for you. So I want to talk a little bit about some of the more advanced therapies we use in the clinic. I won't get into too much detail here unless people really want to. There is controversy around these: intravenous vitamin C, intravenous mistletoe, subcutaneous mistletoe. We use these a lot in advanced cases, and they tend to be very helpful at stabilizing disease, increasing quality of life. I have seen some pretty dramatic decreases in PSA. I meant to bring patients' charts and take some photos of their PSAs that we graph. I can give you a couple of the last few that we've measured. We had a gentleman who started, he's 87, recurrent localized disease. PSA was 9.8 when I started seeing him. We started doing intravenous therapy with him and mistletoe, and his PSA drops 25% in 2.5 weeks, which is fairly significant. Biggest drop I saw was a gentleman that came in to see me, he's in his 60s, highly metastatic disease. He came in, his PSA was 890, it's a little high. Quality of life was doing really well. Some back pain, some pelvis pain. Other than that, doing pretty good. Started on IV therapy with his androgen deprivation therapy, and 2 months later, his PSA was 89, which is a pretty big drop, about 90%. It's pretty much on par with surgery, so that was pretty phenomenal. Yeah?
How do you know what had the most effect?
I do it just through tracking patient care. So when you start adding new stuff in, so And if we start seeing big drops, then we attribute it to what we're doing. Had some other gentlemen where their PSAs were doubling every 2 months, which is fairly aggressive. And we've started doing some of these therapies and they start doubling every 6 months.
How do you know you're suppressing the metastases and not the symptoms?
That when you do your follow-up imaging as well as symptom management, so we see decreases in bone pain and things like that. So, yep.
I understood on the intravenous mistletoe that you build resistance to it after a certain period of time and it becomes ineffective.
Yep.
What's your experience there in terms of time frame?
With mistletoe, yeah, with mistletoe therapy, what they have is there's a whole bunch of different compounds in it, and one of the compounds in it is called a lactin. It's one of the major anti-cancer components in mistletoe. Mistletoe has been used in Europe for almost 100 years now, and the BC Cancer Board just recognized it as a therapy that is helpful. They're not paying for it or anything, but they're saying, you know what, if people are going to use it, that's going to help improve their quality of life, and it can decrease side effects to therapies by about 50%. You're always tinkering with the dose every few months depending on how a patient's responding to it. So when you're using it subcutaneously, which is like an insulin injection, you should be getting reactions, I call them mosquito bites on steroids. It's about the size of a dime, quarter, loony. The red, the itchy is all just scratching on, like, and they throw some calamine lotion on it, it's a big deal. That's telling us therapeutically it's working. We also track it in the blood work. We see the white blood cells coming up. You know, it's working. If we start seeing the white blood cells come down and we start seeing this reaction go away, we take a 2-week break and reintroduce it at a higher dose. And that's how we'll typically do it. So we're always playing cat and mouse with it. After a number of years, yeah, your system will become tolerant to it.
Is that intravenous or
both? Both. Yeah. So as the years go by, when people are using it, we tend to take longer and longer breaks. So typically in Europe, they use it for about a 5-year protocol. And by the 3rd, 4th, 5th year, you're maybe doing 1 shot, 1 treatment every couple of months, even maybe twice a year. So it starts out more frequent in the first couple of years, first year and a half, and then slowly, as patients become tolerant to it, we tinker, like I said, with the dose. Sometimes we take a break and we go back to the same dose and it works well, or we have to increase the dose. So, I don't know if that answers your question. Yeah. Yep.
But there's some serious side effects when you take mistletoe?
Intravenously?
You got women trying to come up and kiss you?
Not yet, no. Unfortunately. Maybe if you took a Viagra with it for blood vessel dilation. Side effects are that red itchy reaction where you're using it subcutaneously. Intravenously, it acts more like chemotherapy, so we tend to see headache, nausea, vomiting. It only typically lasts for about 12 hours. It's not weeks like chemotherapy. You don't see any hair loss or anything like that. I've seen that in 2 people in the last 8 years. Typically, they just kind of feel it for a few hours after they've had it. And they usually will spike a little bit of fever. Because the other thing mistletoe does is it's an immunotherapy. It's trying to increase your natural killer cell counts, decrease your interleukin-6, decrease inflammation. It's trying to modulate immune response and get those white blood cells. So what it's trying to do is stimulate an acute immune response. So I don't know if you guys are familiar with acute versus chronic inflammation in the body. Acute immune responses are colds and flus. Achy, fevery, sweaty, things like that. Chronic inflammation is what most chronic diseases, cancer, arthritis, degenerative joint disease, things like that have, where there's too much immune tolerance to improper cell function. So what mistletoe and a lot of other therapies they use in Europe do, and hyperthermia tries to do this as well, is stimulate acute immune response in the body, get fever going, get the white blood cells to say, oh yeah, look, kitchen's on fire, forgot to check that. So get the job done. Do it. Now there's also, you know, in the States now, I don't know where it is in Canada, but the FDA has approved, it's called Provenge. Have you guys heard of it? It's a dendritic cell vaccine for prostate cancers. Same goal, different approach. They're trying to stimulate acute immune response in the body so that the white blood cells can recognize what's going on. So that's mistletoe in a nutshell kind of thing. Yep.
Is it as effective as propane?
I've never seen any double-blind placebo-controlled multi-trial comparison diet. So I don't know. Who'd see?
Provenge is like 100,000.
Yeah, it's not too expensive, but kind of expensive. So mistletoe, I don't know, 100 grand in mistletoe would probably treat my entire practice for a decade. So, the literature we have on mistletoe is all coming out of Germany, Switzerland, and Austria, where the governments of these countries pay for people to use it if they want to. It's not forced upon you. If you want to use it, they recommend it and they'll pay for it. And what they find is they see typically improved quality of life, improved remission rates, improved overall survival, 10, 15, 25% improvements over your standard therapies, which is fairly significant. So it's one of those things where it may not cure it, but if it keeps you alive for 4 more years and the new therapy becomes approved by Health Canada or the FDA, that's phenomenal too. Right? So, especially if you're going through treatment, if you're feeling good and you're living with it, it's not too bad either as a goal. Right? So, it's not a magic bullet by any stretch of the imagination, but it can be very helpful at stabilizing advanced disease and improving your quality of life. So, those are some of the more advanced stuff we use. There's a whole whack of stuff. I did a lot of training in Europe and Germany for my integrative oncology training, and there's lots of weird stuff, and I could talk for weeks about it. But if you have more questions, you guys can always email me and stuff. Metformin, everyone's maybe heard of this. We talked about it a little earlier. We're getting close to the end here, so down the home stretch. Metformin will drug new tricks. Pretty cool. Metformin is typically used in diabetics. You got diabetes, you got high blood sugar, you go on metformin, you can still eat your cookies, no big deal, everything's great. Metformin, what they're finding though, improves survival rates in many hormone-related cancers. It decreases insulin, and therefore it's decreasing insulin growth factor, which we talked about earlier. It decreases HER2. Now, HER2 you guys may not have heard of. If anyone has family or friends that have breast cancer, you may have heard of HER2 before, but it's human epidermal growth factor receptor number 2. Typically only tested in Canada in women, but in most cancers you see when they become aggressive and they like to go on walkabout, they start to overexpress HER2. And when they express HER2, they express another thing called mTOR, which I love all these acronyms for stuff, it's great. mTOR inhibitors are just being developed right now, and there's a few of them that have been FDA approved. They come with wicked side effects. Metformin's only side effect I've run into in a very, very, very small percentage of patients is diarrhea. And that can be resolved by changing the dose. So it also increases sex hormone binding globulin, which are those proteins that act like sponges in the bloodstream to suck up free testosterone and estrogen, things like that. So metformin is not approved as a cancer drug. This is completely off-label use. A lot of oncologists won't do it. A lot of family docs will consider it. We show them the research and the literature. It's a very, 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 very safe drug. It will not induce low blood sugar in people who have normal blood sugar. This is a common question. So people are used for diabetes. Is it going to tank my blood sugar if I tank it? No, it won't. It's very neat that way. So in BC, where the naturopathic doctors all have prescribing rights, they just have buckets of it, and anyone who has an oncological health concern, they just give it blanketed to everyone because it has the ability to suppress those pathways. Really, really, really cool. Stuff to avoid. Folic acid as a supplement. As a vegetable, it's okay. Milk thistle, we talked about earlier. Chondroitin glucosamine. This is a common one we see a lot of people on for joint pain and stuff. It'll actually accelerate growth. DHEA, maca, and sterols, these are all things that increase testosterone levels. DHEA you can't get in Canada unless you have a prescription, but if you go to Walmart, you can buy eggs, milk, bacon, DHEA. For those of you guys that don't know what DHEA is, it's testosterone's little brother. It's a great doping product if you're an athlete as well. So, luckily, or unluckily, I guess, depending on what you do in life, you can't get it over the counter just at a store here. But I see some patients come in from the States and they're buying DHEA because it's touted for chronic fatigue syndrome, things like that. Gotta be real careful with that one. If you got cancer, it's just another growth hormone, basically. And I don't know if you guys have heard of this one yet. Egg yolks. Choline. I don't know if you guys have heard of this compound before. Stimulates prostate cancer cells to grow. It's fairly new to me. So
why is it you should avoid all of these things?
growth stimulation. Typically not wanted. Right?
That's just if you have cancer.
These are specific for prostate. Yes?
Egg yolks. Okay, well, raw egg yolks
Doesn't matter.
or cooked?
Doesn't matter. So there's a compound in them called choline. Could be classified almost as a B vitamin. It causes the prostate cancer cells to replicate. So I don't know if you guys have heard of CT scans, probably. Has everyone heard of what's called a PET scan before? So this is where they use radioactive glucose. What they're finding with prostate cancer is that actually if you use radioactive choline, it works better than radioactive glucose. And the reason being, they like choline more than glucose. So if you're an egg lover, maybe you want to limit it. Again, is one egg yolk going to kill you? Probably not. But if you have tons of them, you might want to cut back. Yeah, back.
Have you heard of silvestrol?
Yes, that comes under the sterols. Have to be cautious about them. They're really good for viral-related cancers, so like tonsillar, cervical, liver, things like that. But for prostate, now they're finding some other neat stuff. Is that they're finding about 40% of the DNA in prostate cancers tends to have a lot of viral DNA tossed into it. So they're wondering if there's a herpes virus component to it. Again, quite new, no one really knows, but the sterols and the silvestrols, you have to be a little cautious with. Yeah?
4 years ago in Calgary at the Foothills Hospital, then got the medication that killed the cancer. I forgot the name of it. And they tried it on 20 different people with cancer and killed it, and they took it off the market right now.
DCA?
I couldn't tell you.
Okay.
I know if it's still selling it or not.
No idea. Does anyone else know? Hear about it? No?
What are your views on DCA?
Has everyone heard of DCA before? Dichloroacetate. It's chlorine with a vinegar on either end of it. It inhibits an enzyme that cancers use to shuttle glucose into them. It's about as close to chemotherapy as that I can use as a naturopathic doctor. I have a medical doctor who helps me with it. It's a very, very potent compound. You have to be very careful with it and take a lot of support because it does cause some pretty wicked neuropathy, which is hand and foot numbness. And you have to be very careful where you get it because I have some people that just Google it and order it from God knows where on the internet. It could be, it's a white powder, so it could be anything from Tide to cocaine to flour to all three of them mixed together. So last time I checked, those two things don't treat cancer. So you have to be very careful with it. There's another vitamin called alpha lipoic acid. I don't know if you guys have heard of this stuff or not. It blocks that enzyme as well and is way safer than DCA. So, and lipoic acid also is helpful in terms of regulating blood sugar control. So it's a lot safer than DCA. To be really careful with it. Yes?
Will you be touching upon wine?
I don't know if anyone brain. I can talk wine.
Beer?
Alcohol in general? Alcohol, bad for all hormone-related cancers. 6% of cancers worldwide they attribute to alcohol intake, and for breast cancers that estimates up towards almost 25% of breast cancers could be attributed to alcohol. It's a little high. You want to be, again, if you really, really, really like your alcohol, maybe cut it back. One of the things, again, we'll look at in terms of looking at it as a dietary component, continue your alcohol intake. Let's measure testosterone, estrogen ratio, prolactin, all those sorts of things. And then have you stop it for a week or two and then remeasure them. And if we're seeing significant drops, not a good idea to have. The odd glass of red wine here or there seems to be okay. 3 drinks a night, probably a little high.
What about white wine?
I hate white wine. Again, white doesn't have resveratrol and some of the other compounds in it that red wine has. So it's kind of like white bread versus whole grain bread. It's the whole grain stuff, more goodies in it. So, but again, one of these I want to look at is eating stuff. I don't want anyone to be afraid of eating stuff. Okay? One of the scariest things you can run into is you start losing weight. It's very slippery slope to come off of. So if you don't have mouth sores and your digestive tract's okay, you can enjoy the odd glass of wine if you like wine or something. Be grateful and thankful that you can enjoy it and taste it. Don't have the whole bottle. Have the glass. Enjoy it. Because there's other patients that you may meet or talk to and say, you know what, I really wish I could do that, but I have mouth sores that are so bad from chemotherapy, I can't even put water in my mouth. So it's one of those things where, have gratitude for what you're having and taking, and use it moderately, if not less than moderately, but enjoy it when you do have it. Yes?
Yes, getting off the wine.
Yeah.
Would you suggest white bread over whole wheat bread?
Neither.
Neither.
You guys read a book called Wheat Belly?
Yeah.
Wheat's so genetically modified, it's horrible for us now. So I don't know, I grew up in Waterloo, Ontario. I didn't grow up on a farm, but I've got patients who grew up in Saskatchewan when wheat used to be like tall. You'd like hide in it and stuff. Now it's like as tall as this thing. It's been so genetically modified is that they've changed the protein structures in wheat so much in the sugar compounds that it's become a very high glycemic index food for us. So, like I said, that example of a Snickers versus white versus whole wheat bread. Not that we want to put a Snickers in the toaster and put some peanut butter and jam on it and have that for breakfast, but it's got a lower glycemic index. So we want to look at finding lower gluten-containing breads and things like that if you're doing breads and grains, because it's the gluten compound they've changed so much that it's become highly glycemic on a glycemic index.
How was sprouted bread?
Again, if it's from wheat, as long as if you can get non-genetically modified wheat, it's called einkorn. You can get it from these seed banks and seed libraries. I have a patient who's Mormon, and I guess part of their belief system is they store food like crazy. So she's got wheat that's 50 years old, and she brought some and made some flour out of this, and she actually baked a loaf of bread. It ain't anything like the bread we get now. The bread you get now, you step on it and it just bounces right back up, right? And that's the change in the gluten structure that human beings have demanded in terms of Twinkies and Ho-Hos and bread and all those things. I mean, if people were, if everyone travels to, if any of you guys travel to northern Italy, southern France, they still use these old school wheats. They typically, people go there and they're having bagels and croissant, and they're like, oh, my digestive tract and blood sugar is fine. And then they come back here and they think, oh, it's great, I'm healed up. They have it back here, they feel like garbage again. And it's because of the wheat structure has changed so much. So, if you can go gluten-free, awesome. It's not as hard as you think. Try it out for 4 weeks. It's only 0.001% of your lifespan or something. It's not that hard to do. Yeah.
There's a guy out at Strathmore is gone back to growing red fife, which was the original wheat brought over.
Yeah.
And it's unmodified, and you're getting wheat that grows up high like this.
Yeah.
And it's an unmodified.
Yeah, so that would be fantastic.
Yeah. The only thing is, it was subject to rust and a bunch of the different things that we used to get in our wheat out west here.
Yeah. Yeah. You can find them. They're tough, but you can do it. So yes, in the back.
If you rule out wheat products when you want a sandwich, is there a substitute?
Actually, yeah. There's a great gluten-free bread. It's called Energy. ENR. I think capital G to Safeway. And it's not perfectly expensive like a lot of gluten-free breads can be. And it's not like cutting into a deteriorating brick. You know, a lot of times I remember, you know, rice breads and yeah, you cut into it and it all falls apart. And, you know, sprinkling croutons on your sandwich meat kind of thing. So they're working on it. There's more and more gluten-free breads and things coming out. So you know, checking places like Safeway is starting to have a really good variety of gluten-free stuff. Community Natural Foods, Lakeview Bakery is another one as well. It's got a lot of options for people for gluten-free. Yep.
They brought from Russia, friends of mine, what do you call it, purple potatoes.
Yeah.
And Russia claims they're cancer killing. Is there any truth to it?
No idea. It's probably like did everyone get the email, 4 tablespoons of pureed asparagus cures cancer? Yeah, it doesn't. I tried. It's 5. No. There are compounds in all of our plants. Like the more brightly, deeply, richly colored our foods and fruits and vegetables are, the more beneficial compounds there are in them. So a purple potato versus a white potato probably has more beneficial compounds in them. However, I'm going to get the Yankee right now. Eating them is not going to cure this stuff, right? So, you know, if your urologist says, you know what, you need surgery or you need cryo, and you say, no, I'm going to eat asparagus, please reconsider it. Asparagus is definitely helpful, right? It's the same with broccoli and things like that. But, you know, we haven't found yet to date any superfood that you have it in, you know, normal quantities day to day that's going to turn really aggressive things around, right? I gave the example of the broccoli. That was with early, low Gleason, early stage stuff, right? But if we're dealing with more advanced Gleason 7s, 8s, 9s, metastatic disease, things like that, your diet is helpful, but it shouldn't be the backbone of your therapy. Or, sorry, not the backbone, it shouldn't be the sole tool that you're using for therapy. So, I'd like to thank you guys. That's my email. If you want to email me, please feel free to. I'll get back to you in, you know, a couple of days. Typically, it takes me to get through all my emails and stuff. But if you can't read it and you want to email me, drmattpyatt@hotmail.com. Thank you for listening.